All right, it is 4 o'clock on our first weekly Team Kentucky update. We are going to be doing this every Tuesday, though I may have a sub next Tuesday at 4 o'clock to give you not just news on COVID, which we're going to be trying to talk about each week on trends that we are seeing, but also important news that is going on throughout the Commonwealth. And so let's start the way that we always start, whether it is COVID, whether it is moving into our future, whether it is addressing injustices that have been around for far too long and it's time to change. Let's know that we're going to get through this and we're going to get through it together. So if you will, say it with me. We're going to get through this. We're going to get through this together. Today we're going to talk about not just the present, which we spent a lot of time talking about, but we're going to start talking about the future. Last week when we were able to talk about agri-tech, an exciting area that we are going to lead in the future, I think it was something that people needed to see, that we are not going to be battling this virus forever. There is a tomorrow. We are planning for the tomorrow, and we have an opportunity in creating that tomorrow to change our economy, to make Kentucky a leader, to focus in areas that are going to lead for the next 30 years, and to give us a brighter future with better jobs. And so I want to start today with an economic development update, because though COVID has slowed things, while it has taken a lot of attention and while it has caused significant unemployment, I'm pleased to report that outside interest in this state is still very strong. That while we haven't talked about it a lot as we have been dealing with this current pandemic and emergency, we have been working behind the scenes at those next generation of jobs that have been coming to Kentucky. So let's look at an overview of economic development in Kentucky since December. Since December 10th, we've announced 135 new projects, that's in the middle of a worldwide health pandemic, which are expected to create nearly 4,700 new full-time jobs in the coming years, representing an investment of $1.34 billion. This is a good sign. In other states, we have seen a slowing, and we have seen less interest in companies building new things and adding new jobs. These are in manufacturing, service, and technology sectors. It shows that while there is some pause in the current, there is still planning and building for the future. And if we can both deal with our present and push towards the future, what it means is there is a brighter tomorrow ahead of us. Go to the next one. I want to talk about a few of these, because it's one thing for me to say we've got 134 new projects out there. It's another to actually see what some of them are. This is Shine Labs. Shine is a hemp processor and is moving to create 60 full-time jobs for Kentuckians during the coming months. The company's investing $9 million in a processing and extraction facility in Simpson County, a county that is growing significantly, that is a logistics hub, but we have seen a lot of new announcements. Shine relocated from California and already employs 20 at its facility in Franklin. Franklin, by the way, has one of the best Christmas parades in Kentucky. It's something you should take your kids to. The facility extracts CBD oil from Kentucky-grown industrial hemp, and at the end of this, it's going to have 60 good jobs for that community. It produces a variety of CBD products, including full broad-spectrum oil, isolate powder, and water-soluble CBD, which are used for food and beverage products. We know that there's going to be a continuing market, though it looks like it is smaller than people thought it was 3 or 4 years ago for CBD products, and we know how many hemp farmers there are out there that right now need a processor, need someone who can buy that crop, and we want to make sure that we support Shine Labs. Let's go to the next one. This is a new announcement. So the other one we put out there, but it was during COVID, didn't receive a lot of attention, but this is exciting. Tebco of Kentucky. This is a Richmond-based truck equipment and body company that is building out and equipping a facility in Powell County to manufacture custom dump bodies and truck equipment. This is a $2 million project that's going to create 43 full-time jobs in Powell County that doesn't get enough of these projects. It's a place that's got a great county judge, a group that works really hard, and this is a project that we were excited to, in part, deliver. Of course, it was those local officials that helped get out there, that helped recruit this to that area. The plant will be using cutting-edge technology and machinery to produce aluminum and steel-heavy truck products. And we talk about the future. We talk about agri-tech. We talk about aerospace, which we're going to talk about a lot more. Advanced manufacturing is one of those other A's where we can truly be a leader in new technology. The new operation is going to be operational, we hope, by the third quarter of this year. This is going to be a nice shot in the arm for Powell County. So if you look at where the announcements are, they have been all over the state. All 120 counties are where we are trying to lift up, to move ahead, and leveraging Kentucky's many geographical, regional, and existing industry strengths to attract new jobs to these regions. We keep score. We keep score not just overall jobs, overall investment, but making sure every part of Kentucky is going to benefit from that investment. And these are growths by industry. It shows that we want a diverse economy, one that does not depend on any just one sector, one where we play to our strengths of our great workforce, but what you are going to see more and more from us is a focus on the future and those future technologies like agri-tech, like aerospace, like advanced manufacturing, and like healthcare, which is in here and which we recently had a very large settlement to help out our rural hospitals. It's about knowing what our economy is going to be like in the coming decades and not just chasing jobs that were out there in the past decades. Let's go to the next one. This was one of the last official events I got to do before COVID really hit. This was one of the most exciting projects I've gotten to be a part of. This is Crown Cork and Seal. And this was our groundbreaking in Bowling Green in February. It's a $147.5 million facility in Warren County that's going to create 125 new jobs. It's one of the most aggressive schedules I have seen to get constructed, to get up and going, and they believe that Kentucky, they know that Kentucky was the place that could work with them to meet their schedule. It's specifically what we talked about when they came in. And I think this company and its other subsidiaries have a lot more interest in Kentucky too. When you create a good relationship, it continues to benefit both sides. T. Marzetti, which produces sauces and salad dressings in Horse Cave, is going to add 140 jobs at an upcoming plant expansion. This was, when we announced again in February, $93 million project, and this is an impressive operation that already has 350 food and beverage related facilities in Kentucky. It's an area where we excel. It is a company that loves Kentucky. This is their biggest production facility, and we are just growing around it, and they continue to look for those operations. Next one, Smartwood. This is a French-owned company. It shows that we are truly reaching out to the world and making sure that they know about us and invest in us. They announced a 20-job expansion in December for its Corbin plant. They make wooden ice cream and coffee stir sticks. See, this is them right there. It's a multi-generational family company with facilities around the world. And last, Asahi Bluegrass Forge opened in Richmond in 2012 and is expanding to create 20 new additional jobs with a $2 million investment. They make automotive press forgings. It's located in the same industrial park as their first plant. Again, just some of the investment that's going on out there. So I want to say that while the rest of today we will be spending on the present or the near future, we are working hard at that better future. COVID may take up a lot of our time, but it does not stop us from trying to build that better world. And there are going to be more opportunities than ever like this that are competitive and that are out there as we come out of dealing with this virus. So now let's turn to the virus that's taken so much of our attention. I'm going to provide an update, and I'm going to ask Dr. Stack to talk a little bit about where we are and what's going on in other states and why we have to be vigilant. While we are not seeing the type of very concerning spike in so many other states, we are seeing ourselves to continue to be in that plateau area between about 150 and 300 cases. It's something we've got to watch very carefully. Today's case count is 282 new cases of COVID-19, which bring our total cases to 15,624. That's out of 404,781 tests, which, especially for our population, certainly puts us in the top half, if not moving up to the top third of testing in the country. Total number of people ever hospitalized, 2,621, currently 408. Ever in the ICU, 1,019, currently 75. At least 3,990 Kentuckians have recovered. Hospital beds, we're currently under 60% occupancy, which means we have enough beds out there. ICUs, we are about 73% occupancy. Those are mainly from non-COVID patients, meaning we still have a lot of ICUs, and ventilators we're only at about 27%. And that's an important statistic that shows that we have more room. We will post online where the new cases by county come from. The largest ones are 49 in Jefferson, 46 in Fayette, 25 in Warren, and 12 in Laurel. We did also lose 5 additional Kentuckians that we are reporting today. That brings our loss to COVID to 565 Kentuckians. They include a 71-year-old from Hardin County, a 77-year-old from Jefferson County, a 92-year-old from Jefferson County, a 70-year-old from Campbell County, and an 86-year-old from Jefferson County. Again, let's not forget that this virus is deadly. It preys on those that have pre-existing conditions, and while we have lost some people in their 30s. Just because the majority may be older doesn't mean the person that spread it to them isn't younger. Let's remember it's not just those that have died, but those that get the virus that can spread it to those who die. We are in this together. We've all got to take responsibility for our own actions, and we have to make sure that we're never the cause of spreading this to someone whose body ultimately can't take it. When we look at our long-term care facilities, again, this is our first update since June 24th, 189 new residents, 100 new staff, 19 resident deaths attributable to COVID-19, 8 new facilities. This continues to be an area where we have to be very, very cautious. Before I ask Dr. Stack to talk about where the rest of the country is and what we have to avoid, we have got to talk about masks. We are seeing more and more states out there passing mandatory mask rules. And while we are not there yet, understand that a mask is the best way to show that you care about other people. And I see a lot of adults. I see most adults out there not wearing one. So I want to read a note from a 13-year-old, Chloe. Chloe says, our goal is to put a mask in the hands of as many kids as possible to help them prepare for school reopening. We have been fundraising by selling our own masks on eBay for 6 weeks. We're buying fabric and all the supplies we need and are now ready to start making masks. Masks are free to kids. Concentrate our efforts on local schools where children cannot afford a mask, and we want to make a basic mask that they get to design. They sent me an email with their idea. They just want to share it and hope we'll do the same. They're working with their local school, and they get it. It's been a fun project. It'll be a win-win for everybody. This is Kathy, Chloe, and Kelly in Union, Kentucky, and they were kind enough to send my kids a couple masks that show how easy it is. And I'd like to think if these kids and their parents, this one's for me, if these kids and their parents get it, why can't we all get it? It's about caring about each other, and in many ways, yes, it's about knowing that it's not comfortable, but it's something we do for other people. It's a sacrifice that we make. Following these rules, following all these rules, is absolutely critical to make sure that we don't go the way of Florida, of Texas, and of other states. And especially now that we reopened so much this last Monday, we have a responsibility, all of us individually, to do what it takes to be reopened at this level and not cause a spike in cases. Because if we do, and if we have to roll things back, it will be because we individual Kentuckians did not take the responsibility to make sure we followed the rules to do it safely. It'll be on us. The same way that each and every Kentuckian deserves praise for how we have flattened this curve, we have to know it's now our responsibility to keep it low. So I'm going to ask that Dr. Stack come up and give us his evaluation of where we are. And separately, Louisville-based company we haven't talked about, Focus, makes caffeinated sparkling water. I usually use the mug, but when we have a chance to show what some really great Kentucky companies are doing, I want to take that opportunity.
Thank you very much, Governor, and good evening, everyone, or good afternoon. James, if we could put up that slide deck. Thank you. So we're going to go on a little journey here and review where we've been. So we have attempted to take in the state of Kentucky a gradual and calibrated approach to reopening. We've tried to use data and science to guide us when we thought it was safe and reasonable to open without taking an unacceptably high risk for spreading the disease and exposing people to harm's way because of it. So this is just a partial journey that we've gone through in June. To summarize, phase 1 reopening was essentially May, phase 2 was essentially June, and now June 29th and into July, so essentially July is phase 3. So yesterday began the first part of our journey into phase 3, and this is following the President's Opening Up America Again plan and a 3-phased approach to reopening. We have, again, like I said, tried to be gradual and phased so we didn't get into trouble quickly and we could take adjustments if we needed to. James, if you could show the next slide. It's hard to believe already 2 weeks plus have passed since I shared a version of this slide. So there are 4 states represented. In the top left, we have Arizona. Bottom left, we have Florida. In the top right, we have South Carolina. And in the bottom right, we have Kentucky. The y-axis on the left is the same for all of these. So the curves represent relative to each other the nature of the epidemic in these 4 states. I took this from 91-DI-VOC last night, so it's data through yesterday, June 29th. What you can see on the left, when I showed Arizona 2 weeks ago, they had 180 COVID positive persons per 1 million folks. They have more than doubled up to over 400 per million residents. Florida, in the bottom left, was at about 80 people per million. 2 weeks ago, they are now 300 people per million, so they've tripled in 2 weeks. South Carolina went from about 125 per million to 250 per million, which is a doubling in 2 weeks. And the state of Kentucky was at about 50 per million 2 weeks ago and about 50 per million today. So we have stayed relatively flat, as the lines will show there. That is not an accident. That is because you have made sacrifices that have made this possible. We did healthy at home. We took steps to socially distance ourselves and to try to buy the time we needed to learn more about the disease, to get testing in place, to get supplies to protect healthcare workers and to protect you, the Kentuckians they serve, should you seek medical care. If we can go to the next slide, James. If we do this, it won't stay that way. If we do this, we look more like Arizona, more like Texas, more like Florida, more like South Carolina. Now, I know where this picture was taken. I found it when I was looking for news clippings this morning when I put the slides together. But it doesn't matter where it was taken. This is anywhere USA. This is any time people to get together. And this is, in a normal world, good. We like this. Social engagement, enjoying each other's company, that's good. It's not good in coronavirus land because we spread the virus too easily when we get close like that. You'll notice, go back, James. There's no mask wearing. This was May 17th per the caption in the news coverage, so coronavirus was well known at that point, but mask use wasn't promoted as aggressively. There's no mask wearing. People are too close. We know those things now should not happen because it increases the risk of spread. Next slide now, please, James. So this is what's happening. This is where we'll end up if we do what we saw on the previous slide. This is a picture here in the bottom left from a bar in Alabama that says closed again with a frowny face emoji there, or emoticon, I think is what you call those. That was from a newspaper this morning at 6 a.m. We also have next to it an executive order from Governor Abbott in Texas where he has closed all bars and established any entity that earns more than 51% of its revenue from sale of alcohol has to close. Restaurants have been reduced down to 50%. That's where we are now. We have just gone to 50% recently. Rafting and tubing are closed, and outdoor gatherings, more than 100 people must be approved by local government. So just to put in context, this is now Texas we're talking about placing these restrictions in place. We also have bars restricted in Florida, hospitalizations increasing in more than 12 states, as announced today, I believe, by some of the healthcare leaders nationally. But we are not powerless. We have things we can do to reduce the risk. The single most powerful thing you can do, and the cheapest, is to wear these masks. If we could show the video, we have a couple other people who talked about this over this journey.
I signed an executive order which will require the wearing of masks or face coverings when inside any retail establishments, including grocery stores, pharmacies, and convenience stores, or when riding on any form of public transportation in Maryland. It also requires all essential retail locations to require their staff to wear face coverings and requires those businesses to put into place appropriate social distancing measures in order to keep their customers and their staff safe. In our immediate efforts, this is really another important step in our immediate efforts to protect public health and safety. But the wearing of masks is also something that we may have to become more accustomed to in order to safely reopen our state.
Not only do people die from this, but people get horribly sick from this. And I think as that reality sinks in, I think more and more people will wear a mask. Now, we have mandated it, as you know, for every employee. Again, this is not about politics. This is not about liberal or conservative. This is not a liberal or conservative issue. This is a issue of how do I protect my neighbor? How do I protect people that I love? How do I protect people that I don't even know? And so we just need to get this beyond that this is some sort of political issue. It's not at all. It's about protecting each other. It's as, it's as old as the scriptures, love your neighbor. I don't know any other way to express it.
So those are the governors of Maryland and the governors of Ohio. And of course, Ohio is just to the north of our river. And we've taken a fairly similar journey to Ohio, and our governors have communicated throughout this crisis. And so it is possible to do these things, and it can have a really enormous impact. James, we could do next slide, please. So we're going to watch some metrics. We're going to look at things like this. We're going to look at the number of new positive cases. So we report to you in absolute numbers how many new positives we have. We'll continue to monitor that to see if we have any surge. So far, we have not. We're going to look for the test positivity rate. You've heard about that in the media. That's an important metric, because if the rate starts going up, and in South Carolina, I understand it's over 20%, that's a sign that the disease is spreading and spreading aggressively. We're going to look at hospital trends. The governor reports to you whenever we do these what we understand to be our hospital bed capacity, both for regular beds and ICU beds. And we also look at the percent of those hospitalizations that are COVID patients. We'll look at these things and try to see when the trends are up or down and try to use them as indicators for when we might see ourselves heading in the wrong direction, or if we're staying relatively stable and can stay the course. James, if we could do the last slide. So I got to make this point again. We are not powerless in this journey. This is a journey that we can control to some extent, though incompletely. I have talked to a lot of businesses over the last few months, and a lot of them ask, so are we safe if we do this? If we do it this way, so that's safe, right? The answer is, there is no way we can guarantee that it is safe. We can only reduce the risk, but we can reduce the risk knowingly and effectively if we do these things. So we talk about hands, face, space, and of course we've added testing now. So please, you gotta keep your hands clean with soap and water or hand sanitizer. You have to use a mask. This is really simple. Please do it, because I think folks don't realize this is like a boomerang and it will come around. And so there are stories in the media where whole families, 5 people in a household or 5 people in an extended family, have lost their lives because it hit their family so hard. Please don't be that family and don't be those individuals. Space, keep distance from yourselves. We talk about 6 feet. There are reasons for that. More than 6 is better, but at least keep 6 feet between yourselves. And please, if you've been exposed to someone, if you develop symptoms, if you are concerned that you may have a risk for having the virus, please get tested. The federal government has taken steps, and we've taken steps in Kentucky to try to make it easy, or at least as easy as possible for folks to get the testing. Ladies and gentlemen, we have undeniably blunted the curve in the state of Kentucky. Over the last 120 days or so, since we started this on March 6th, we have undeniably kept that curve flat. This is a success in the middle of a very, very difficult situation. Where we go from here is in all of our hands, all of us individually, and as we look to the 4th of July holiday, where people will make use of these activities, these bars and the restaurants, if we want to stay open, these are the things we have to do. If we don't do these things and you're operating a business, if people start getting sick, the hospitals start filling up, and death numbers start increasing, they won't show up at your business to consume your services. So we have to do these things to keep Kentucky open and keep ourselves on a good path. So thank you very much, Governor.
Because we will not have another one of these briefings unless something comes up before the 4th of July, we need you to be safe. Safe not just for you, but your actions create safety for the people around you and that you may interact with 10 days after the 4th of July. Remember, so many people can be asymptomatic that if you put yourself in a dangerous place, you get the virus, you can feel fine. It can be 5, 7, 10 days after, and you can spread it to somebody who won't be fine. So hands, face, space over the 4th of July. Overall, we did a pretty good job over Memorial Day weekend. Let's make sure we continue to protect one another. And if you see that there's a huge spike in other states, that it's happening at the beach, don't go. If right now you have reservations in Myrtle Beach, why would you go when we know that it's being brought back from there and it's dangerous to you and to your family? So let's make sure that we protect one another. And I want to, we also have an update on pandemic EBT. Today we have the Secretary by video.
This is Eric Friedlander, Secretary of the Health and Family Services Cabinet. And today I want to talk to you about pandemic EBT, PEBT, or those meal replacement, funding for those meal replacements for children who have missed those meals in schools, and presumptive eligibility, the health care coverage, that temporary health care coverage through Medicaid that we've given for 2 months. So the time to sign up for PEBT is coming to a close on June 30th. We are going to extend the time for application to the end of August. We've seen a recent upsurge in folks who are trying to get the PEBT benefits, and there still remain some questions of folks who are trying to get through. So with this big upsurge, we've signed up over 516,000 individuals. We know there are another 100,000 out there, so we want to give everybody the opportunity to sign up. That's why we're going to extend the deadline for signing up for those benefits, just so that you know that you have time to do that. Next, presumptive eligibility. That's the healthcare coverage that many of you signed up for using the one-page application. It is Medicaid coverage that was short-term. Those of you who have that coverage that will be ending on June 30th, we will be extending it for 3 months unless you contact us and ask us not to extend. We will be reaching out to you to help you sign up for regular Medicaid, and those of you who are not eligible for regular Medicaid, we will work with you to see what is possible. So thank you. We'll get through this, and we'll get through this together.
Well, that's exciting news from Secretary Friedlander in that additional help on food and on health care as we get through this. And please, make sure you are signed up for some form of health care coverage. Everybody qualifies for some form of health care coverage. And I think the story that hasn't been told about why we are where we are in this virus, well, it's twofold. One, we've talked about. It's all the sacrifices Kentuckians have made. It's the amazing job you've done. But the second involves how we expanded Medicaid and we reduced our uninsured rate, the number of people that don't have health care coverage, the number of people that don't go see a doctor, so significantly in the years before this happened. And I think when you compare us to states that didn't expand Medicaid, you will see a difference. It is how in Kentucky, where we have some of the highest rates of the conditions that COVID preys on, diabetes, lung cancer, heart disease, that everyone predicted we would have lost a lot more people than we have or that we will. The fact is, if you get people seeing a doctor regularly, even in the midst of an international health pandemic that's coming for them, we can protect them. Let's make sure we continue to protect each other. If it's in your church, in your classroom, in your place of business that you think people aren't signed up, there's a form of health care coverage for everybody. Let's work to get everyone signed up. Now, dealing with COVID has been hard. And one thing that it has caused all over the United States is widespread but temporary unemployment. It's created claims all in a short period of time, more than we have seen, I believe, in that period of time, in the history of our country, certainly in the history of our Commonwealth. I think what we have seen in Kentucky and where we are up to now is a story of what happens when two things occur at the same time. Number one, for years you starve the safety net system, making it less strong and less resilient with fewer people, fewer resources, and less technology. And at the same time, a health pandemic hits, increasing unemployment at a scale that you've never seen before. It's almost a perfect storm. And if we look back, now let's go to the slide about some of the things that happened really since 2017. It wasn't that long ago, about what's led to where we are right now. It was first the closure of 30+ regional offices. People want to know why we can't have an office open everywhere. We didn't have one before this. It's not about reopening. It's about the fact that they were closed already. It's about the loss of 95 employees. Think about the fact that a good processor might be able to get through 20 claims a day. That's almost 100 employees, 20 claims a day. You can do the math. We could be helping 2,000 extra people just with that group every single day. We can't have computer systems that are 20 years old. Think about how much computer systems have changed since then. And a budget that was almost slashed in half. And think about that. Half the budget of 2017, when claims weren't anywhere where they are right now, in dealing with what we are. Now, I've seen some reaction out there of people thinking I'm trying to lay blame. I'll take responsibility for where we are. But I hope everybody else that participated in starving this system accepts responsibility, but more than that, commits to making sure that it won't happen again in the future. Because I see a lot of people who in the past didn't support people filing for unemployment that rightfully so now realize how critical it is. So I hope it's an awakening about how important these systems are and where we're going to go in the future. So the question is, what do you do when you got this system that has been starved, when you don't have close to the number of people that are trained, and suddenly you have widespread temporary unemployment? How do you address it in the short time frame that you have when people are struggling? So we've taken a couple steps. Number one, we moved the UI office, which we learned, to a cabinet that we believe had more support that could be brought in. Education and workforce worked really hard, but there are a lot of cross-trained people in the labor cabinet. We brought a cabinet secretary directly into that office every day, bringing that management level of experience to make sure we could get through this. We have increased our number of people that are processing claims. When this started, really about 40 people with almost 1 million claims. Now to nearly 100. We restarted in-person visits, though remember the number of people we have makes that challenging, and that we have to open and not reopen offices. And soon we're going to put out an RFP to upgrade this system. I believe during this pandemic that we can use dollars potentially from the CARES Act, but we cannot continue to function with a system designed to tell people no at a time when we need to tell people yes. But today, we're announcing a contract that we have entered with an outside vendor that I believe can help us catch up on our claims from March, April, and May by the end of the month of July. This contract is, if you can go to the next one, with EY, which is Ernst & Young. It's one of the big four accounting companies, one of the largest companies in the world that deals with tax, unemployment, and that already has the personnel, skill, and experience and resources to help get the job done. The purpose is to get us caught up and get us caught up quickly. Not over 5 months, but this is designed to get us as close to caught up in 1 month. EY already has experience doing this. They worked with the state of Colorado, where they provided 100 people to process claims, and they processed over 30,000 claims to help them catch up. We're looking at about 56,000 claims from March, April, and May that we must get fixed right now. So we have entered into a contract that starts July 1 and runs for 4 weeks. It's going to move fast. Starting this coming Monday, EY is going to provide us 200 individuals that will be processing claims starting Monday morning. 100 of them have already done it in Colorado. The others will be trained up. And what that will immediately do is triple our workforce as of Monday. We have about 100 working on it now. Monday, with these extra 200, we will be up to 300 employees. We're going to add 100 more after that as soon as they are ready in the coming weeks. The contract is going to be paid for by CARES Act funding. It's going to be about $7.4 million. Seems like a lot for a 1-month contract. It is not if it gets us immediately caught up, and it gives us 300 individuals from one of the most sophisticated companies in the world that has done this. Currently, we have 100 employees in the Commonwealth doing this. We will build up to 400 employees by July the 13th. E&Y has 50,000 employees in the U.S., and of the big four, it is by far the biggest in Kentucky, having chosen Louisville recently for an expansion on parts of its back office. In addition to helping in Colorado, it's helped in other areas of the unemployment crisis in Oklahoma, and it's what we have to do here if we want short-term help. To give you an idea, 300 new employees, if we did it directly, would cost us about $30 million over the course of a year. It would take us 4 to 6 months to get them trained to process claims. We simply can't wait, and our goal here is to get caught up to the fact that we don't in the future have to have 400 employees if we believe, like we do, that this surge is temporary. EY is also going to be reviewing the processes we use, the data and the technology. And this is going to go along and free up more people, our direct employees, to do in-person services around the Commonwealth. We've been in Owensboro and Ashland this week. We're going to be in Somerset and Hopkinsville next week. And like I said, we're going to be issuing an RFP to make sure that we can have the infrastructure we need going into the future to make sure that this doesn't happen again. EY is the type of company we believe that can help us get there. Now, I want to be transparent. Like all the big four, I know people, have friends that are at EY, but that's like saying I have friends that are at Google. This is the area and the help that we need. This contract is going to help us get caught up. We have been notifying legislative leadership of it today. We believe that there is support for it. I'm sure they will look at the contract, and they should. But this is our best chance in the short term to help as many people out there as we can. And we believe the process that they will use will help prioritize the oldest claims and get them resolved first. So we think that's exciting news. You know, it's doing what's necessary, It took us a while to get this contract negotiated, something that I did not personally do. But it's going to help us, our goal to catch up by July the 31st, and not just hopefully catch up on those months, but if we're moving fast enough, to catch up on the fact that we have so many claims filed every single day. Let's get absolutely current. All right, I want to end with a report on our state budget. Now, I've told you before that this virus is decimating every state budget across the country, and that if we do not have additional stimulus from the federal government, another CARES Act, that we would be facing devastating cuts, and I believe I've told you before, I think that they would be the largest cuts that we've seen in our history. Here's our projections. Without additional CARES Act funding, this state is facing around a $1.1 billion shortfall in the next fiscal year. I think it was because of this concern that the legislature only enacted a one-year budget, saying we should be very careful and limit our spending to the next year. If we do not have federal help, and it could come in two forms, either the ability to use some of our current CARES Act funding directly to help our budget or another round of CARES Act funding, we are looking at potential cuts between 16 and 29%. To put that in context, I believe our single biggest annual cut that I'm aware of in our history has been 12%. So what we're looking at right now with that extra assistance is one of the most difficult years in budget balancing that we have seen. This would be like letting Kentucky go bankrupt, which we cannot allow to happen. So let's continue to push our federal delegation. We've had good communication with them and say that we can't let this happen in Kentucky, because this hurts education, it hurts social services, it's going to hurt our ability to provide UI, unemployment claims. It's going to hurt every single thing we do and further starve the systems that people are relying on. Now, this is also why you are seeing this administration tighten our belts. You know, we've seen from at least a couple boards that are out there, 2-year contracts at pretty large salaries. We don't want to step in and take over for that board, but with a 1-year budget at these potential cuts, this Commonwealth cannot be obligated to 2+ years at high dollar amounts. The only responsible thing to do that the Finance Cabinet Secretary is trying to catch every single one is make sure all of our spending for this next year is limited to just this year. It's what the legislature saw with a 1-year budget, and look at this. If we're going to have the single largest budget cuts of all time, potentially, let's make sure that we don't get out there as individuals that might like leadership in a certain area of the state and commit to dollar amounts that we know that we may not have moving forward. Let's be responsible. All right, so today we talked about the positives of the future, and we talked about the difficulties of the future, but I still have hope here that our federal delegation will do the right thing. By the way, if they provided the same stimulus they provided in 2010, 2009, 2010, it is almost exactly this amount. We could balance our budget, still wouldn't be a great budget, but we could ensure that there were no major cuts. All we're asking is in the middle of a worldwide health pandemic, the Congress do the same thing that they were willing to do during a recession. That seems pretty simple to me. We've also talked about where we are in COVID, how we need to make sure that how we are going to catch up and to make sure that we are serving the people of Kentucky. So with that, we'll open it up to questions. We got a bunch of people today. We got Debbie Yetter, Monica Harkins, right? Good. Catherine Collins, Lawrence Smith, and Dennis. Are you Dennis? There you are. Welcome. Dennis, let's start with you.
With the election results coming in today, we spoke with Secretary of State earlier about the possibility of extension voting coming in, and that would require universal powers and
I haven't had it. The question is, with election results coming in today, have I talked to the Secretary of State yet about what the November election might look like? I think Dennis said that he's talked with them today. We haven't yet. But I will say that It's pretty simple that when something's going well, don't screw it up. I think that's what my dad told me about just about everything in life. I mean, why mess with success? The Secretary of State deserves a lot of credit, and I think we had a little something to do with it, about creating an atmosphere for the largest primary turnout in our state's history. And it's not complicated. It says if you make voting easy, more people vote. So how did we make voting easy? Well, in the middle of a health pandemic, we said that we can safely do voting by mail, and we proved that we can without fraud. You know, the argument that's always out there is fraud. Well, we did it without fraud. So we ought to be able to do it moving forward. We did it through early voting, to be able to go in, more people early voting than ever before, and we did both of those without any excuses. And then we had some efficient polling stations, though we need more. And the last thing we did is we restored voting rights based on an executive order that I signed over 170,000 Kentuckians. We just had the largest primary turnout in our state's history. Let's not move backwards. And I think Secretary Adams deserves a lot of credit for this. I think that there were some in his party or in my party, and he got some, and I got a number of tweets about folks nationwide that didn't understand the other things that we were doing, because it's hard to know everything we're doing through a tweet. But I think he helped create an atmosphere where more people got to vote than ever before, and that's a pretty incredible thing. Lawrence? So for those who are still waiting, if you can sign up for an appointment, or if you've already gotten in, go to your appointment. But what it means is that there are now going to be 300 extra people that are going to be calling you on the phone, that are going to be emailing you, that say, I want to fix your claim. What is the number one, criticism isn't the right thing. What's the number one, and complaint's not the right word, it's the reality that we hear. It's that they can't get somebody talking to them to fix their claim. We're quadrupling our workforce. They're going to start calling people with the oldest claims first. I'm sure we're going to learn that there are some other issues out there that we can fix. But what it means is help's on the way. We're spending what it takes to get it done, and we are moving as fast as we can. I hope that we help everybody from March, April, and May by the end of this month, and I think it's going to pick up really fast. Karen? Right.
Do you have an anticipated timeline?
I don't yet have an anticipated timeline for how the November election will work. That's going to take an agreement between myself and the Secretary of State. I wanted to let him get through all the work that he's had that's done today, but I'm sure we'll start meeting. And the two of us getting together has never been a problem. I think we've both been available every time the other person has needed to talk. I have no complaints about the communications or the ability to talk there. But again, my message, let's not go backwards. More voting is good for democracy. More voting is good so that everybody feels like they are a part of democracy. Let's look at some things we could do better. We do need more polling places in our largest counties, even though I think that the one they did in Louisville worked efficiently. The other thing we need to do is look at our hours of voting, but that's not the fault of any county clerk or the Secretary of State. It's a statute that we passed, and we've got to look at changing it. Now, I believe we only have the ability under the Constitution to add an hour, and so we're going to need to look at a constitutional amendment ultimately to expand more of those hours on Election Day itself. And while we're doing that, why not add in the restoration of voting rights and make it permanent? Debbie?
What is the percentage of secondary custody? Is that something you all have to get into the court so we can figure out how it's
Steve, do you have our percentage positive rate? We do get that. We can report it. Some of the national groups do it. We've been fairly low.
Yeah, so it's less than 1% for people pre-procedure at hospitals across the state, and it's probably in the just over 3% statewide.
Okay, so the question is, what's the rate of tests that turn out positive that we get? And we're doing right now tests in a number of different places. We're doing tests for elective procedures. Hospitals are doing them when someone comes in, make sure they don't have the virus. That one is under 1% right now. That's a good thing for people who need those procedures. Statewide, this includes our drive-in. It also includes all of the nursing homes that we are testing. And I got to say, while the numbers look big, we are having a lot of negative tests come back in areas where it can spread. It's even in the prisons that we're doing right now, and that number is still under 3%. You look at some states right now, and they're reporting 20%. And so while I'm proud of where we are, it can change very quickly. It's a fragile but good place we're in if you can be in a good place while dealing with COVID. Monica?
Dr. Fauci was saying that bars are really not good right now, and obviously we've seen that they can get pretty crowded. What would you say about, you commented the 4th of July could be an interesting time for this. What would you say to people about the spacing in those bars?
The question is, Dr. Fauci today testified that bars are a real problem. And with the 4th of July coming up and us reopening bars, what would I say about spacing in them? I would say two things. Number one, to the owners, if you want to stay open, you have to enforce social distancing. Some of the most conservative states in the country just closed their bars fully. We want an opportunity for you to be open, but your ability to be open all depends on not spreading the virus. And that means, my recommendation, and it's just a recommendation right now, have a seat for every customer and make sure they stay in that seat unless they're going to the bathroom. If you can do that, you can enforce people being spread out. It would be a very good suggestion. If we have to, we'll look at it as a rule. But if you allow people to pack in, and we've seen it. I remember when restaurants first opened, you remember when we showed that video of the place in Lexington? That's exactly how things spread. Now, to the folks in the facility that are packing together, this thing's killing people. It might not be people you know. You might think that it's worth the risk to you, but everybody who dies from getting this has had it spread from somebody else. So can't we care about each other enough? I mean, at a bar to drink 6 feet away from each other, you can still hear each other. It's just such a small price to pay to protect people. But we're going to have to watch it very closely. Areas that we're seeing around the country, we're seeing bars, we're seeing gyms. Gyms have to be very careful. We're seeing churches, we're seeing places where people are in for about an hour. It's how long you're in with the recycled air and how close you are together. And all of it's avoidable. 6 feet apart, wearing a mask, make sure you're not doing things where you project droplets. We can do all these safely, but it takes us having the responsibility to do it differently. And we got to expect to do things differently. It's a worldwide health pandemic. I'm sorry that you last in this line.
Along the same lines as Monica's question here, considering what we know what can happen if people do not wear masks now, that more people will be inside bars, other establishments, why not mandate masks at this time?
The question is, why are we not mandating masks at this time? And it's because of where our numbers are. I'm worried about, with summer here, how many people may not be following the rules. I will tell you, we're hearing about businesses where the employees aren't wearing masks. That's mandatory and can shut you down if you're not doing it. So I hope every owner and every manager knows that we have to enforce that. And if you haven't seen the stories that name facilities where it's spreading, you don't want to be that facility. I don't want you to be that facility. It's not a threat. It's what's important for your business. I will say that if we have significant increases, we'll look at mandating masks. While I don't think we're there right now, my commitment in all of this is I was going to put politics aside, put what's good or not good for me in the future aside, and do the right thing for our people. Kansas has done it. North Carolina's done it. But then you also have to get down into the details. And the problem is, if somebody just sees a tweet that says Andy Beshear is considering mandating masks, where? It doesn't mean if you're outside you have to have one if you're apart from people. If you're 6 feet away from somebody, you don't necessarily have to have one. But you need to have one on you to where when you can't be 6 feet apart from everybody, you can pull it up and make sure that you're safe. In other states, it's when you go indoors to shop. That would mean customers and not just employees of different facilities. So it's not if we have to go there that everybody wears one all the time. It's that when you're going to be around people and you could potentially spread it to them. But I think it's important to be transparent. If we see a spike like we've seen in other places, we're going to pause the reopening stuff that we're doing. We're going to look at what are the highest spreading areas, where in the state, and surgically, if we have to, roll back. It wouldn't be an everywhere. It would be to address the issue that's there, and then look at whatever else we have to do. We've come too far to lose more people than we have to during this. Is it back to you, Dennis? The question is, the Secretary of State apparently has mentioned funding, which is important when you look at our budget, and voting and how it might impact, I guess, November. I believe that funding would rightfully come from the CARES Act money. It is about protecting people. So if we back up on just what's good for democracy, because more people voting is good for democracy, we also still have COVID out there. And if you vote in a precinct like mine, everybody who's volunteering or working there that day is in the risk category for COVID. We can't let that happen again either. We use National Guard and it defrayed costs during the primary. I think we will see that again. Remember, these aren't folks that are in, these are our neighbors that answer the call when we ask them to. I believe that we can't have just a election as normal pretending that COVID is not there with the same election poll workers that we've previously had. Karen? If we don't get federal help, this budget hole will devastate just about every part of state government. We won't close, but when you look at where we were going into the first budget I proposed, where for the first time in 12 years we weren't having to make cuts, and now we're facing at that lower threshold where we were already potentially the largest cuts we've seen. It just, there's no alternative to additional federal help other than the people of Kentucky suffer for it, and state employees would suffer. It's something that we shouldn't have to go through. We don't have to go through. It's a pretty small amount of money that the federal government would have to provide compared to what they've already provided. And they haven't said no. And I don't think that my message here is that any of our federal delegation, except maybe Senator Paul, has said no on the record. But if you care about this state, you ought to care about what this budget would do to the people of our state. Lawrence. My question is my take on the Democratic Senate primary. Let me first say that it was nice not to be on the ballot, given just last year that I was. We have a new state senator that was elected in a special election today. She is a physician, and it's going to be a big help when we look at COVID and health care here in Kentucky. I don't just think she will be a great state senator. I think that she has the skill set to really help us in areas that we need it. And as to our U.S. Senate primary, I think we had great candidates that worked really hard, that created interest, that drove the largest primary voter turnout that we've seen. I think everybody that ran is a winner, and I mean that. I think that they are all winners, that there's bright futures for everybody. Charles Booker ran a race with a number of votes that, if we had gone back in time, was enough to win just about any election, any primary election we'd seen. So I think we have multiple winners coming out of this primary, and I hope that everybody can quickly shake off, and let me say this on all sides, what the toughness that is a primary, and move forward into a general. I remember a tough primary too. Debbie.
On the PED benefits that occurred during the strike, is that the same for children who are out of school and have there been some issues with folks being able to file claims or access
Well, while he was here by video earlier, he's here in person to answer your question. The question is on, if you'll repeat the question.
So is the benefit you talked about, is that the SNAP benefit for kids out of school, and has there been trouble accessing benefits for
So Debbie's question is about the PEBT and those benefits. Are they SNAP benefits? They are the benefits to replace the meals that children would have gotten in schools. So we've had a bunch of folks sign up. The last 2 days, our call line surged to about 20,000, which is about as much as we can handle, maybe a little more. So rather than try to force people through that kind of smaller sieve, we extended the benefits to August just to make sure folks could get signed up. We have, I think I said, we had about 500, a little over 500,000 that signed up. We were estimating we had about another 100,000 to sign up. So that's what we just want to give everybody the opportunity to sign up. And there's some folks in private schools who actually qualify for some of these benefits, and so we're going to reach out to them as well. Tomorrow we're going to have a press conference. We're going to be going to one of the senior centers here in Frankfurt, and we will be delivering our millionth meal since the pandemic began. We really ramped up services and meals to the elderly, and so through the Meals on Wheels programs and other programs, lots of collaboration, lots of partners across the Commonwealth, and so tomorrow we'll be delivering our millionth meal. It's really a testament to how much we have all worked together as a community.
Let me say this now, we are this many months into COVID. Thank God for Eric Freelander, has been a huge help. Monica.
And then in Lexington police and protesters with the Black Lives Matter movement are still working on conversations about changing police contracts. Obviously, this has been ongoing this whole month, but can you give us an update on where you stand as far as maybe helping these local governments and deciding how to move forward?
The question is, especially in Lexington, on talks, and I think there have been talks, which is dialogue, and sometimes dialogue can come in different forms between protesters and the police. And I think what we all have to recognize is that systematic racism is real. We have seen it, whether it's intentional or not, by any individual. In policing practices, we have seen it in our penal system, where we have rates of incarceration that you cannot explain away any other way than implicit bias and racism. And I believe that people all over this Commonwealth understand that now is a time that we have to truly address it. That doesn't mean it's easy to address. It is complicated, and it's going to take that dialogue, because part of where we have to get is people have to listen and have to hear. And we have to share experiences too. But we have a more robust conversation going on, even though it's tense at times, than we've ever had. And it's important for me not to pretend like I know the 5 things that we need to do, but to listen as well and make sure that I'm hearing an experience that I have not experienced personally in my life. But I believe that this moment in time is about more. It's about police practices, but it's also about injustice, inequity. We see it in healthcare. I believe that the fact that we are losing African American lives at twice the rate of the population during COVID is also a driver in what's happening, that we haven't seen the type of economic justice and opportunity that should be out there. And I've even experienced a little bit of this when I announced that what we were going to try to do on healthcare. And I announced it like this. I said, I believe that healthcare is a basic human right, and we're going to work to sign up everybody across the Commonwealth for some form of health care coverage. And what I am hearing, and what is the truth, it's an inescapable truth, is that our African American communities have not had priority in so many different areas. And given that the population's dying at twice the rate that they make up, how about we start there? And I'll tell you, some of the things that I heard back prove to me that we've got a long way to go. My hope is that we're up for the task and that we see real, fundamental change. I know there were some that disagreed with removing Jefferson Davis from the rotunda. I will never regret that decision. Every kid that now walks in to that rotunda, a place of honor, doesn't have to look at someone who fought to continue the enslavement of their ancestors, and just the symbol would suggest that they were less. That time should be passed. It's clear that it's not fully passed. That doesn't mean we can't work to make it the past. One last one.
Senator McConnell has said recently that he plans to take a close look at the country's economy in July and then decide what to do with relief then. Have you talked to him recently about that, and how do you feel about the potential that more relief is coming?
The question is about Senator McConnell saying he's going to look in July at where we are and decide about additional forms of relief. And have I talked to him recently? We have talked about this a couple times, and he takes all my calls. I take all of his calls. I don't think I've talked to him in the last week or so, but he knows where I am on it, and he heard me out. I know there are some things that he wants to negotiate, and I don't get in the middle of the DC negotiation about other things that they want. I'm simply advocating for what we need in this state, which is this type of budgetary relief. We need it sooner rather than later. We're starting our fiscal year in July. We need some certainty on it. I will say that because ideas have been floated out there, that it may be that they allow us to use the current CARES Act funding to fill budgets, that many states have not expended all of it, because if that's what they say and you've already spent it all, then you're in a world of trouble. And so we just need the certainty about where Congress is going, and this is just a necessity. It's not a red state, blue state. We are all in so much trouble if Congress doesn't provide the needed aid. And again, if we're willing to do it in a recession, just an economic downturn, why aren't we willing to do it right now in the midst of COVID, when we've seen the largest jump in our unemployment, while temporary, that we've ever seen? Now is the time for statesmanship and for everybody to come together that says outside of COVID they might never do this, but they are absolutely going to do the right thing now. So I hope the fact that we are looking at great challenges doesn't necessarily increase people's anxiety. We have faced challenges before, and we've come out on top. We found solutions. We've offered one today with the help of EY quadrupling our workforce in just a couple weeks to address our unemployment claims. And we're going to continue to look at every solution that helps us to address the challenges we face without ideology, just looking to do what is best for our people. And I just want to end by saying, and I think I said this in a video the other day, as this thing goes on, it's easy to get caught up in the negativity. When we're kind of shut in our houses and our places of business, where maybe the only outlet to the outside world is social media, which is becoming increasingly toxic, so much so that advertisers are pulling out, and I wonder about its future. Just remember that we care about each other, and the positivity that we can still share and our ability to come together is why we don't look like other states. We are in the middle of one of the greatest success stories in the history of the Commonwealth about how we have stood up and protected each other while other places, other states, other countries may be failing. This is our challenge, it's our time, it's the challenge of our generations, however you want to say it. This may be the biggest test and the most difficult test that we ever face. Let's make sure that we pass it. And let's remember that other generations face tougher. So we know that COVID's going to last longer. We know it's going to create challenges that we have to address. This is our world, and those are the situations. Our job is to develop the policies, to protect one another, to do the best we can every day, and I know that's going to be enough. So thank you, everybody. We're going to get through it together, and we will see you next week.